Welcome to our comprehensive guide on suturing techniques. Whether you're a medical student, a dental professional, or simply curious about surgical procedures, understanding suturing is essential for wound management and healing. In this video, we'll walk through the most common suturing methods, their specific uses, and the advantages each technique offers. We'll also discuss suture removal and potential complications. Let's start by exploring why suturing is so important in clinical practice and how mastering these skills can make a significant difference in patient outcomes. The simple interrupted suture is the most commonly used technique in clinical practice. This method involves passing the needle through both wound edges at equal depth and distance, typically 3 to 4 millimeters from the wound margin. Each stitch is tied individually with a surgeon's nut, allowing for precise control of wound aversion and tension. Sutures are spaced 6 to 8 millimeters apart to distribute tension evenly. One major advantage is that if a suture loosens or becomes infected, the others remain intact, enabling targeted removal. This technique is ideal for wounds requiring strong closure and flexibility. Proper spacing is crucial when placing interrupted sutures. By positioning each stitch 6 to 8 millimeters apart, tension is shared across the wound, reducing the risk of tissue strangulation and promoting optimal healing. This spacing also helps maintain wound eversion and prevents gaps that could lead to infection or delayed healing. Understanding the relationship between suture placement and tension distribution is key to achieving the best surgical outcomes. Interrupted sutures offer several advantages. They provide strong wound closure, allow for precise control of wound aversion, and each suture is independent. This means that if one suture loosens or becomes infected, the others will still hold the wound together. Additionally, individual sutures can be removed selectively, which is especially useful in cases of localized infection. These features make interrupted sutures a reliable choice for many surgical situations. The simple, continuous, or running suture is a rapid technique that distributes tension uniformly along the wound. This method involves a single strand of suture material that runs uninterrupted from one end of the wound to the other. It provides a more watertight closure, which is beneficial for wounds requiring a sealed environment. However, a notable disadvantage is that if the suture is cut at any point, the entire line may become slack, compromising the closure. The continuous locking, or blanket suture, is similar to the simple continuous technique, but adds a locking mechanism. The suture is withdrawn through its own loop, which locks each stitch in place. This prevents excessive tightening during closure and is particularly suitable for long edentulous areas, tuberosities, or retromolar regions. The locking feature ensures that tension is maintained even if part of the suture line is compromised. Mattress sutures are designed for tension-free flap closure and to resist muscle pull, ensuring wound edges are properly averted. There are two main types, horizontal and vertical mattress sutures. Both techniques are used in situations where strong closure and eversion are needed, such as extraction sockets or high-tension wounds. Let's take a closer look at each type and their specific applications. The horizontal mattress suture passes from one wound edge to the other and back horizontally. This technique is ideal for broad contact and eversion in wounds with high tension, such as extraction sockets. By distributing tension across a wider area, it helps prevent tissue strangulation and promotes healing. The horizontal mattress is particularly useful when a strong, stable closure is needed. The vertical mattress suture involves passing the needle at two depths, deep for support and superficial to bring the wound edges together. This is often referred to as the far, near technique. It maximizes wound eversion and minimizes dead space, making it ideal for wounds where precise edge approximation is critical. The vertical mattress suture is a go-to method for achieving optimal cosmetic and functional results. The figure of 8 suture is particularly useful for closing extraction sockets and adapting the gingival papilla. This technique involves looping the suture in a figure-8 pattern, which provides secure closure and helps maintain tissue position. It's a versatile method that can be used in various oral surgical procedures to ensure proper healing and stability. Subcuticular sutures are used for cosmetic results, especially in areas where minimizing visible scarring is important. This technique involves continuous lateral stitches taken beneath the epithelial layer, providing a smooth, aesthetically pleasing closure. Subcuticular sutures are commonly used in facial surgeries and other procedures where appearance is a priority. Proper suture removal is essential to prevent complications. The procedure starts with cleaning the area using saline. Next, the suture is gently lifted, and the thread is transected close to the surface. Finally, the suture is pulled out carefully to avoid tissue trauma. Following these steps ensures safe removal and reduces the risk of infection or scarring. The timing for suture removal varies depending on the location. For mucosa, sutures are typically removed after 5-7 days. Skin sutures are taken out in 7-10 days, while those on the face, eyelid, or lip are removed sooner, usually within 3-5 days. Scalp sutures may stay in place for 7-12 days. Adhering to these timelines helps minimize complications and ensures optimal healing. Delayed removal of sutures can lead to several complications, including sutural abscess, scarring in the form of stitch marks, and even dermoid cyst formation. It's important to follow recommended timelines and removal procedures to avoid these issues. Early recognition and management of complications are crucial for patient safety and recovery. In summary, mastering suturing techniques is vital for effective wound management and optimal healing. Each method interrupted, continuous, mattress, figure-of-8, and subcuticular has its own advantages and specific applications. Proper suture removal and adherence to timelines are essential to prevent complications. By understanding these techniques and their nuances, healthcare professionals can provide better care and improve patient outcomes. Thank you for joining us on this journey through suturing essentials.